yeah, we would probably have to medicate them. Okay, again, changes in our GI tract. We mentioned that progesterone, it's relaxing everything. So it relaxes all the vessels and all the mucous membranes and everything in her mouth. So her gums become very soft, very edematous, much more likely to bleed when she goes to the dentist. I would always get yelled at because I was always pregnant. You're not flossing well enough, I'm pregnant. So I can't use that excuse anymore, but I still don't floss much. Tylism develops. Tylism is an excess in salivation. We don't know why. Somehow related to pregnancy. And it's not just a little, it can be lots. To the point of a person needing to carry a cup with them. It's just rolling out, rolling out. We don't know why. There's all kinds of theories, but there's no reason to say why. It's a nuisance. It's something you may want to, when you're counseling these women, tell them could come, so when it comes, they're not too upset. But it could be a big problem. Imagine me, if that was me up here and you had to watch me drool all day. What if she's a police officer? You were speeding. It could be a very big problem. You laugh, but it could be a problem, depending on the person's lifestyle. So just something to know about. Esophagus, same thing. Everything is relaxing, and we know what happens when our sphincter relaxes and our stomach relaxes and the esophagus relaxes. Everything's kind of rolling around in there. So she eats, and it can come back up. So heartburn is a problem. Remember my pictures. What did we do to that poor woman's stomach? It's up here. It's about this big. And now it's relaxed. So it's going to be very likely that she's going to have a lot of heartburn and be very small capacity in that stomach. So what are we going to advise her to do? Small, frequent meals. Right. Small, frequent meals. Because she has really got an anatomical problem right there, and then everything is relaxed. Okay, we also have, let's go back to what we mentioned earlier about her iron. We talked about her iron, which they're all getting, some more, can contribute to constipation. Well, now we've relaxed all her intestines. We slowed it all down. And we're giving her iron. And they're all shoved up into here. So constipation is a huge problem. And we're giving her, well, we've given her the iron, but we're telling her to eat more iron. So it's a big problem for these women. And then you take the pressure, and we said we got up to 20 pounds here, sitting down on her rectum and her anus, so hemorrhoids are a problem for this lady. So keeping her flowing is one of our big priorities when we're counseling her through her pregnancy. All right, this is just another visual to kind of see what we were just talking about. You can see her stomach up there is just this one little sliver. So she can't hold much. It's relaxed. It would be very easy to roll right back up into her esophagus for that heartburn effect. Her liver's pushed off to the side, and then down there, this third little arrow is pointing to that teeny tiny little area that was her bladder. So what happens with a lot of these moms towards this last pregnancy, they don't have an appetite, they can't breathe well, they can't get a good deep breath, and they don't want to drink much because they keep running to the bathroom. So a lot of creative nutrition counseling is needed. All right, what happens to her urinary system? Well, we said it's all relaxed. The bladder's about this big towards the end of the pregnancy. So to handle all the metabolic changes and the increased blood flow, the kidneys and the ureters have to get bigger, just like the breast. So the kidneys are enlarged to hold all the extra blood and waste products. First trimester, last trimester, urinary frequency is a problem. I mentioned earlier that when she has that big old baby in that uterus, that stress incontinence can be a problem for her too. Just generally, but then if she laughs or she coughs, something like that, can be a problem. This is something that a lot of women come in the last part of pregnancy thinking their water has broke, and we test them and it's just urine, which is very discouraging and sometimes embarrassing for them. But it's very likely and very common that urine is kind of coming out when you don't want it, which adds back to our infections and our perineum with our increase in vaginal discharge. UTIs are common because everything's kind of leaking out, high in glycogen, and you put this big belly here, and hygiene can be a problem. Just physically getting down to clean places and keep everything tidy down there. So she is a candidate for vaginal infections, as we mentioned earlier, and UTIs because of all these situations that she needs to be told about and asked, how are we managing with this? Maybe she's someone that you need to get a shower, handheld shower or something like that. Because it is very hard to get down there and take care of business. So again, counseling about these things that she may not have thought of, or she may be too embarrassed to ask about. Her integumentary system changes there too, and none of these are fun. These are the things that really she might be more upset about than some of the other things because they're visual changes. Hyperpigmentation as a result of the hormones. So that line that runs from her umbilicus to her symphysis is called the linea nigra. Linea meaning line, nigra meaning black or dark. And then cloasma, or some people refer to it as melasma. It's the same darkening pigmentation that happens on her face, usually her cheeks and her cheekbones. Not fun, kind of depressing. It's usually happening as she's getting towards the bigger stage, and she may be not having the best body image ever. They will fade, particularly the face will fade. It's better if she stays out of the sun during this time because that can make it more pronounced. It seems to happen more to darker skinned people, but it will fade. The striae gravidarum, let's break that word down. Striae meaning stripes. Gravidarum meaning related to pregnancy. Stretch marks. Yeah, fancy word for stretch marks. Something that happens that nobody wants to happen, and some get them and some don't. It all depends on how much elasticity you have in your skin. So thank your relatives if you didn't get them. They usually start out as bright red, almost like somebody scratched her, and then after the pregnancy is finished, over the next months, they will fade to more of a whitish, grayish indentation in her skin. You cannot avoid them, no matter what the commercials say. It's not the top layer of your skin that has the problem. It's the next layer under that without elasticity, it rips. And if you ever had stretch marks, you can feel it's an indentation that the lower layer has ripped apart. And that's just genetics. Musculoskeletal system, okay. We still get muscle relaxation. Yeah, Ryan.
Do all the things you're going over, I know you said that stretch marks don't happen to everybody, but there's some hyperpigmentation doesn't happen to everybody.
Everybody gets a touch of it.
Mostly everything else we're talking about happens categorically?
Uh-huh.
Okay.
And even the pigmentation, everybody's nipples will change. Some change, like if you have pink nipples to begin with, they're not going to get as pronounced as someone that has darker nipples. So everybody will get a touch of some of it, but not to the degree that other, like the facial involvement thing, not everybody will get that. But everything else, the system changes, yes. Yeah. So now we're talking about her musculoskeletal system. We talked about progesterone, which is relaxing all the smooth muscles. Well, that includes all these too. So she is not as steady as she used to be. Again, this back has already got more lordosis, and now her back muscles, her abdominal muscles, are not as able to support her. So another reason lower back pain is a problem for these moms. They also have another hormone that started to be produced by the placenta called relaxin. And relaxin's purpose is to relax joints, particularly the joints down in her pelvic area. So if you think back to biology 204 or 205, I don't know which one has the bony pelvis, it's held together by cartilage. Well, now that cartilage has been loosened up. So her pelvis, all those joints are moving around to some degree. And the idea is Mother Nature does that so that when that big head comes through, the pelvis will widen to allow that baby to come through. But it's happening weeks before then. So she's got this, again, let's go over it. She's got the muscles that aren't as strong. She's got this big old weight here. And now she's got these supporting joints that are now given on her. And they're shifting, which is great when you need to have the baby, but it can be very uncomfortable and make you very unsteady before then. So pelvic discomfort, we talked about the ligaments, that can cause her pain. If they get kind of stretched and go into spasm, then the pelvis just can ache. Remember, we talked about the nurse on the 12-hour shifts. By the time she goes home and then has to come back the next morning, a lot of discomfort and achiness, and then her back. Now, this is going to make her very unsteady. Now, whoever watches Sex and the City, and Carrie Bradshaw went through her pregnancy in her stilettos, no. No. Tell your patients no. They need nice, stable footwear. Because, and I will demonstrate this, when I'm standing here, where is the center of gravity in my body? Hmm? No. My what? No. Straight down the middle of my head should be my, now, people with bad posture, but if you're standing the way you should, you're not leaning this way, you're not pulled that way, you're standing straight up and down, and your center of gravity should be right at the top of the head. Did your parents ever get you for your posture? Stand up straight, like you have a string pulling you. So that's your center of gravity. But I take 20 pounds and I plop it right here, just like maybe if I was trying to pick up one of those chairs or pick up a heavy bag of books. I'm going to pick it up, and just automatically I'm going to lean back to balance me, because now the center of gravity is pulling me forward. But to compensate for that, I'm going to pull it back to take it to the car. I'm also going to widen my stance. I'm not going to try and carry it like that. I'm going to widen my stance, I'm going to back up, and I'm going to get this big bag of books upstairs. What do I look like? I look like a pregnant woman. That's exactly what happens to her. Her center of gravity gets pulled forward, and subconsciously, she just starts to widen her stance and lean back, and that lordosis makes it very easy to do. So it's just Mother Nature's way of changing her to accommodate this big weight that's in front of her. Which again, you don't want to wear unstable shoes because your gait is not secure. Questions? Make sense? When I had my first, I had just graduated from nursing school in June, and I got pregnant. I got married the week after, and then I got pregnant that September, unplanned. And I didn't want to tell anybody. Here I was a new nurse, and I didn't want to make them think I just did that. So I didn't tell anybody, and it wasn't until January. I worked in the ICU at NIH. I was walking across the unit, and some nurse screamed out, "Bobby, are you walking pregnant?" And that's exactly what she saw. She saw that I was just kind of huffing around like this, and my secret was out. Watch pregnant women in their walk, and it's very, very characteristic.
I have a question.
Yeah.
Is there like a week or a trimester where the relaxin has accumulated enough to really see this effect, like for the woman to really notice the effect, or is it just happening a little bit by little bit all the way along?
I don't have an answer to that. I would think it's a gradual, and because it's gradual, she may not notice it dramatically, but if you had her be able to feel what it felt like before she was pregnant and feel it now, she'd notice a big difference. What you're going to hear them say is, I tripped, I fell, and I never fall, or it's going to be back here, or the heaviness here. It's going to be all a discomfort here. They say, if I could just have something hoist this up, because everything is so loose here, it just feels like it's pulling on her.
Okay, so that'll be their subjective.
Right, that's what you're going to hear. Pressure and my back hurts.
Okay, thank you.
Why don't we take a break now? I'm going to come back at 11:45 we'll be back. And if I have not gotten a data form, please give it to me. Or if you need one, let me know.